In this segment, we're going to demonstrate a counterstrain technique to treat an anterior lumbar AL2 tender point. Now, the AL2 tender point is commonly found just medial to the anterior inferior iliac spine. So we'll find the anterior superior iliac spine, we'll move them a little bit medial and down about an inch or so, just medial to the anterior inferior iliac spine. And again, we're going to press. First, I'll check on the patient's left from medial to lateral. And then when I start to press down and medial and lateral on the right, we have that tense edematous P-like feeling, and the patient has that tender point response. So we're going to tell the patient to remember that, and we're going to quantify that as a 10. Now remember, the amount of pressure used to elicit a tender point is only that amount of pressure that would blanch the nail bed of your palpating finger, and typically it wouldn't be tender in healthy tissue. So remember, that amount of pressure is not diving deep into the tissues. Relax your hip and knee, fall asleep, fall asleep. And again, this classic position is going to require flexion, probably about up to almost 90 or plus, where we get to the level of L2. When we probe, it softens up under my finger. You should feel the tissue around there release. And then the classic position to completely alleviate this tender point is going to require the hips, knees, and pelvis to be rotated away from the tender point, which is going to rotate the upper segments toward the tender point. And then we're going to take the feet away from the tender point and even down toward the floor a little bit, and you should feel the tissue under your finger totally soften up. Now, clinically, this is associated with myofascial structures innervated by the L2 nerve root, typically the lateral border of the psoas major may be involved, but also the external oblique muscle. So we find this position of flexion, rotation toward, side bending away. Hold here for 90 seconds. After 90 seconds is up, we slowly reposition the patient back to neutral again, totally relax, take the patient into flexion so they don't help you try to put the hips down, and then let those feet just drop right down to the table, and then slowly back down the table. Your finger has not moved from the location, and now repress, and hopefully it's 0 or at least a 70% reduction of the original tenderness.